Good afternoon, everyone. Welcome back once again to the CERCA Monthly Expert Talk for the month of April. CERCA Expert Talk is a monthly feature, as we all know, where we present national and international experts who speak on important issues related to climate change and air pollution. Environmental pollution has been a matter of concern for many years. It is now well known that environmental contamination has a tremendous impact on health. As per the World Health Organization, every year 2.4 billion people die from causes associated with air pollution. It is increasingly recognized that the implementation of strategies to reduce pollution can have substantial benefits of health. Therefore, efficient mitigation strategies need to be implemented for substantial environmental and health co-benefits. Today we have with us Dr. Harshal Salve, an eminent researcher, scientist, and a doctor from the All India Institute of Medical Sciences, New Delhi, who would be speaking on how mitigating the impact of air pollution on health outcomes warrants a multi-pronged collaborative approach. As the coordinator of CAPHER India, which is a collaborative on air pollution and health effects research in India, a joint collaboration between All India Institute of Medical Sciences and IIT Delhi, he would be discussing as to how this platform would provide an opportunity for young early career researchers to come together and work towards a multi-pronged collaborative approach for mitigating the impacts of air pollution on health. CAPHER India is a network that includes scientists from epidemiology, exposure science, biostatistics, population science, social science, NGOs, and the private sector. Dr. Salve has 14 years of experience as a physician, teacher, and a community-based researcher at AIIMS, New Delhi. Dr. Salve worked with the Ministry of Health, Government of India at the national level, state governments, and international agencies such as the World Health Organization and ISEE on expert committees, capacity building, research projects, and technical reports. His major area of work includes non-communicable diseases, air pollution and health effects, climate change, community mental health, and health systems research. Dr. Salve is a member of the WHO Collaborating Center and Minerva at AIIMS and was part of the interministerial central team for assessing the response to the COVID-19 pandemic in the state of Maharashtra and Rajasthan. Dr. Salve contributed to generating awareness regarding COVID-19, air pollution, and other public health issues among the general public on print and TV media. Currently, Dr. Salve is working at Comprehensive Rural Health Services Project at Ballabgarh. Dr. Salve received Dr. Sushil Nair Young Leaders Oration Award and the Presidential Award by IAPSM. Dr. Salve has received fellowship from the Indian Public Health Association and has received an award for contribution as resource faculty in the Skill e-learning and telemedicine facility at AIIMS. Dr. Salve has experience in conducting 30 funded community-based research projects, and he's a coordinator of CAPHER in India, funded by the Health Effect Institute, Boston, US. Dr. Salve organized capacity building workshops and consultations for researchers and other stakeholders in air pollution and its health effects under CAPHER. Dr. Harshal Salve has 60 publications to his credit in national and international peer-reviewed journals with H-index of 12. Dr. Salve has written a chapter on mental health in the IAPSM textbook of community medicine. He is working currently as an additional professor at the Center for Community Medicine at All India Institute of Medical Sciences, New Delhi. Well, gentlemen, the talk would be of 30 to 40 minutes duration, which will be followed by 15 minutes of question-answer session. I would now like to invite Dr. Harshal Salve to deliver his talk. Over to Dr. Harshal. Thank you.
Yeah, thank you, Dr. Hemant, for first of all inviting me for this beautiful platform of CERCA, which not only engages with the young researchers and also it's a good platform for knowledge sharing and for a very exhaustive introduction. So let me share my screen and please confirm if it is visible or not. The first
Yes,
slide is
visible.
visible.
It's visible.
Yeah.
Visible.
Yeah, thank you so much. So today we are going to discuss about the partnership and collaborations for taking air pollution and health effect research in India forward. What are the things which are required and why it is important to have a collaboration and partnership with various agencies, researchers, stakeholders to take this agenda forward. The leadership and leader in public health, because as Dr. Hemant said, my almost more than 15 years career is in public health. I am specialized in community medicine, public health. So we always talk about the leadership, and it is crucial for taking any public health intervention to scale up that intervention to have a meaningful impact at the community level. What we all strive for, to have some meaningful impact in the livelihood of the people. That is the ultimate goal, what we all, the professionals, are working. So it is the leadership is a process whereby an individual influences a group of individuals to achieve a common goal. So goal is common and we have to connect to each other so that and influence each other. And it has a collaborative and servant leader who needs and aligned disparate voices together behind a common mission. So for the collaboration and partnership also, the goal should be one. Though we have our specialization, separate aims, separate specialities, and separate sort of competencies, which may be different for different stakeholders and different sectors, but our goal should be common so that this we can work together in a collaboration. Why environment health is important? Because it is, you can see in this picture, it is one of the dimension of the community health or a holistic health, what we talk about in public health. Without environmental health, that cannot be the holistic health. That's why it is important to get sensitized to the environment health and as well as to understand about the challenges and the interventions and the solutions available for its issues. And as far as the burden and the data is concerned, almost 24% of the diseases, that is a morbidity, and 23% of mortality, it is attributed to the environmental risk factors. So first is a stroke, followed by the ischemic heart disease and unintentional injuries. So it is also, you can say, the priority as far as the health is concerned. Coming to the briefly about how you categorize the environmental risk in as far as the health sector, the level two level, you can classify the various level. So from level 0 to level 4, in level 2 it constitutes unsafe water, sanitation and hand washing. And then air pollution also features in the level 2, which has particulate matter pollution. Then you again classify into ambient particulate matter or household air pollution from the solid fuel. So there are level 2 related risk factor as far as the environmental risks are concerned. Now, why it is important to study the air pollution? We all know that it is contributing hugely as far as the mortality and morbidity globally concerned. And as we are advancing in terms of the science, in terms of the measurements, both on the side of exposure as well as on the side of health outcome, we are able to gain more insights about the intricate relationship between air pollution and various health outcomes, starting from the maternal child health to now to the cognitive outcomes. So it is every eighth death in India is attributed to the air pollution, and air pollution is the second most common leading risk factors in India. That is measured in the Delhi, and PM 2.5 again identified as a major pollutant in India. 99% of Indian population encounters air pollution level that is exceeds 10 microgram per meter as per the WHO guidelines. So we know the problem. We know that it has to be addressed so that if we really need to change the scenario of a morbidity and mortality at the community level, and we know who is a culprit. So if we really need to move forward, what we need is a collaboration and a partnership. So what is collaboration? Again, the dictionary definition of collaboration is each stakeholders operate independently. So each sector operate independently with the control over their activities, and they have their resources, but they have one goal to work for. And in the partnership there is a platform which sort of help to engage these stakeholders and also to monitor the activities to various mechanism, and all the stakeholders contribute the resources. So there's a subtle difference between collaboration and the partnership, but ultimately the goal is the common, and it has to be the win-win situation for all the partners or the collaborators in the mechanism. So this we need to understand whenever we need to move forward on this agenda. Why there is a need for collaboration with respect to air pollution and health effect research? We really need to provide a leadership at the cause. As we know, the air pollution requires a multifactorial intervention at various level. So one has to provide a leadership to sort of steer this various stakeholders and for the common cause. Here we are talking about the research. So that needs to be steered. So leadership is the one of the rationale for collaboration. Then generating local scientific evidence. We do have the evidence available with respect to the morbidity, mortality from the sort of few part of the country, let's say mostly from the southern part of the country or few metro cities, but there is a need for generating evidence with the various newer health outcomes which are being studied globally from our country. Also, there is need to generate evidence for what work, what doesn't work, because ultimately we are interested in the interventions for mitigating this problem. So there is a need for generating local evidence. So collaboration is required for generating local evidence. Working with the national programs. So when we say the national programs, both sides. So on the health side, we have national program for human health and climate change, where air pollution now is featuring very strongly in our response. We have a national ambient air, national air pollution control program from the CPCB Ministry of Environment and climate change. So on the both sides, we have a national program as a response of the country, and these are the systemic ways to deliver our interventions which are designed scientifically. So we really need to work with the national program, and ultimately advocacy and the communication, the collaboration with the various stakeholders, starting from media and to the community, both from the upwards and downward communication is essential to make a difference at the ground level. So if we, why collaboration is essential, we'll go one by one. So I will give you one example where, in terms of our work with IIT Delhi here at All India Institute of Medical Sciences. So how this collaboration helped us? This collaboration helped us in capitalizing the strength of both the institutes. So at All India Institute, we at the Center for Community Medicine has a strength, expertise or skills with respect to the epidemiology, medical sciences, learning cohort, where I'm currently sitting. We have a cohort of more than 110,000 population, which is running for last 30 years. The network development, we have various network as suggested in my brief C with respect to Minerva, which we have a 26 institute network, and the CAPHER India, where we have more than 180 researchers engaged in the network. That is our strength at AIIMS, Center for Community Medicine. At IIT, we have a strength with respect to exposure assessment, technology, GIS, modeling, and other innovative methods in personalized exposure measurements and the satellite-based exposure measurement. So this collaboration from IIT Delhi, we are working with Professor Sagnik Dey from Department of Atmospheric Sciences. So this collaboration helped us in using our strength and sort of minimizing our limitation with respect to the various expertise and move forward on the issues. And most important thing is institutional mechanism. Here is a partnership where there is a one mechanism which brings these two institutes together in the form of some formal MOUs or network. So this is very key. This is very essential. Why? This is to ensure sustainability for the effort. Even if I am not there, Professor Sagnik is not there, but these institutes will going to stay for decades or come. So that these institutionalized mechanism will ensure the sustainability for this collaboration. Just to highlight few work we have done together in terms of scientific information generation is we did some mortality estimation with respect to PM 2.5 in the area I was just referring to in the rural area in the Faridabad districts and in Delhi all district in urban population. We try to use the satellite data provided by the Professor Sagnik and his team, and with the mortality information available from the urban and rural area. So here we work in that way. So these are the variables. I will not go into detail, but these are the variables and the data which were used under this project. And we have published also from the urban side with respect to the information available from the Delhi at district level and correlated with the PM 2.5, which shows that 52% increase in all-cause mortality for every 10 microgram rise in short-term PM 2.5 exposure. This is again well cited and sort of literature available in the public domain. This is again from data from the rural side, where we sort of documented that deaths over a period of time in a rural area. This is again the first time there is a effort has been made to document the mortality with the PM 2.5 exposure in the rural area, which it is again it is in the peer review currently. So our study showed that 0.03% rise in incident rate ratio for daily deaths which are non-trauma related due to the PM 2.5, and there is also the delay response of the PM 2.5 was observed in our study. So this is again a multivariate analysis. You can say the all-cause mortality was related with the PM 2.5 exposure. This is again another local evidence data generation we did with respect to the DRIVE project with IIT Delhi, where we tried to correlate the OPD consultation for cardiorespiratory diseases with the PM 2.5, and we have seen a significant association of incidence ratio with the OPD consultation for cardiorespiratory diseases with the 7-day lag. Uh, here we are trying to sort of you all are aware in 2015 and 16 there is the Delhi traffic rationing system modern even rule was sort of implemented. Here in this, using the AIIMS data set, we tried to sort of estimate what it has in terms of impact on the APM 2.5 and the health mortality and the hospital inpatient registrations. So there was no significant difference was observed. So these are few studies which were conducted in AIIMS with support to IIT Delhi. This is again, as I said, it is important to document what work and what doesn't work with respect to the air pollution. Again, this is a systematic review. It is under a publication to the international journal. So we have tried to document various interventions. This we have conducted under a DRIVE project. What works and what doesn't work with respect to the outdoor air pollution and with respect to the indoor air pollution. This is again a work we did, our team did at AIIMS with respect to the mental health outcomes and the air pollution. So this is a particular meta-analysis we did with respect to depression and the PM 2.5 exposure. It got presented in one of the international conferences that shows a significant association in the pooled estimate as far as the depression and the PM 2.5 exposures are concerned. The second advantage of collaboration is working with the national program. As I said, there are national program for human health and climate change, which is run by the NCDC, National Center for Disease Control, under Ministry of Health, Government of India, and our department at AIIMS, Center for Community Medicine, is a center of excellence for cardiopulmonary diseases. So we have developed a health adaptation plan for cardiopulmonary diseases for all the states. So this action plan, the states are now using it for developing their interventions at the state level and for implementation of the intervention with respect to the cardiopulmonary diseases. This work we did with the IIT Kanpur, where the district level mitigation, air pollution and health related impacts, strengthening capacity for or capacity building for district level nodal officers. Under the NPCCH, we have a district level nodal officers who manages the program at the district level, where mostly the action happens. So here for UNF, along with NCDC and the team from IIT Kanpur led by Professor Mukesh Sharma, we have developed this training manual. Again, the first of its kind activity we did currently in the country, where all district level program officers are being trained. The second activity we are doing along with the Professor Mukesh Sharma's team at IIT Kanpur is a review of a national ambient air quality standards. So the CPCB has given mandate to the IIT Kanpur, and we at AIIMS are collaborating with them to do a health survey so that some insights can be collected with respect to various levels of air pollution and the health outcomes, and some suggestions will be made to the expert committee of CPCB, so that the air quality standards can be reviewed and revised accordingly. So this is again a collaborative activity we are doing along with the IIT Kanpur. In this activity, we have exposure scientists, whether led by the Mukesh Sharma. We have from AIIMS, myself, and we are from NPL, Dr. Sharma, who is a part of this team. So again, this is a collaborative effort. I will say the effort which are required at the national level and will contribute significantly as far as the national response is concerned. This is again this training followed by this training manual development. We had this training sessions. So almost 60 to 80 nodal officers are trained in the country for air pollution related illnesses by the Ministry of Health, by the Government of India. Again, this is an example of a collaboration or partnership of the government agencies, institutes, research institutes, and the technical institute as far as the IIT Kanpur is concerned. So again, this has taken up strongly, and now the action plans are being developed under this program for addressing air pollution and health at the ground level. So subsequently, you will see the scaling up of these interventions in all the states now. Now coming to another important need for the collaboration, that is advocacy and the communication. Here the communication is the key. Here now you can see the heat wave is going on. The various activities related to the advocacy and communication at the ground level with the communities going on. Similarly, we have developed this health air pollution related IEC material for the NCDC under our Center of Excellence at the AIIMS. Now this is again, I will say, the communication with respect to the work we are doing in the CAPHER India. We have a air health bulletin. So every year we take out one issue of this air health bulletin on National Day for clean air and the blue sky, which is on the September. So last year it was, we had our inaugural edition, and we are looking forward for the entries which can be featured in this air health bulletin, where we mostly document the work by the young early career researchers as a research work, as well as whatever work CAPHER India as a joint collaborative now effort is taking up throughout the year that get published here. So I encourage all the young career researchers to contact us, and if they want to submit some work as an abstract, or they are doing any activity with respect to air pollution and health effect research, be it some advocacy talk, so that can we can very well cover this in the air health bulletin features. Again, it is important to have advocacy with the policymakers, where you can see here we had a discussion with the air pollution health effect research, with the international agencies, with the government of India, what should, and with the various experts here, advocacy with the civil society partners, and advocacy with the media and communication agency. Again, it is important to convey the specific message to the right people, so that to focusing on the right skill is the sort of a goal of advocacy and communication campaign. Media are the important stakeholders, and that has to be used wisely by the scientists like us and advocates like us for clean air related research. So our research, a collaborative work with respect to CAPHER are being sort of very well covered in the media. We have also used our expertise in the CAPHER India for advocacy related to providing the right information with respect to the air purifiers, with respect to the smoke towers in the country, and that were widely covered in the media and the newspaper. We have media workshops where we have participated and help them to shape up their advocacy strategy with respect with the government, the state government, and the central government accordingly. Community engagement, again, a very important aspect of a collaboration. We really need to collaborate with the community also by ensuring their inputs in our response. So, for example, under the DRY project, we have engaged with the agriculture sector related representative, be it agriculture officer at the district officer in the Faridabad district, or with the farmers, with the farmer associations, the Kisan Sangh and all. So we discuss with them with respect to the parali burning issues. So what are the challenges and the facilitators which are available with respect to these issues. So that helps us to understand this issue in depth, as well as to formulate the response what is possible. Here, so we're able to identify few facilitators and the barrier with respect to parallel burning in the rural area of Haryana, here in Faridabad districts, where non-availability of the alternative rapid no, alternatives, rapid crop cycle, lack of intersectoral coordination, and everything was identified as a facilitator. But barriers were they were not aware about the air pollution related illnesses, the financial penalties were there, engagement with the PRI. So all these factors which are coming, and again, this article we have converted this into the scientific paper. It is in the publication. Uptake of the intervention, again, it is important to advocate. One of our student is doing a thesis on uptake of this monitoring applications of the air quality, be it SAFOR or CPCB at AIIMS. So at the community level, what is the engagement, what is the sort of uptake of this intervention, what are barriers, facilitators. One of our students work on the uptake of Ujjwala scheme and the mask use with respect to the air pollution. So we really need to engage with the community to understand the barriers and the facilitators with respect to what are the available interventions which are available from the government side, from the local government side, national and the state government side. So again, we had this consultation with where all stakeholders related to the air pollution were there, and we really need to identify the sort of path forward to move forward with respect to NCDs, which are again constitute majorly with respect to the mortality and morbidity and the air pollution. Now, coming to the what are the challenges with respect to air pollution health effect research? First is outcome assessment. So mostly the non-specific health outcomes are there. You can see most of the studies. So these are non-specific health outcomes, and the association with the health outcomes and the risk, mostly the environmental risk, be it any, is a more hyperbolic association. It's not a straight. So at some point of time, you will really see the plateauing of the response with respect to the health outcome is concerned. So whenever you really need to test the intervention, you really need to reduce the health or environmental risk drastically if you need to have one significant impact on the health outcome. So outcome assessment, availability of the data with respect to the health is the challenge currently in our country. Exposure assessment, again a challenging. Mostly the studies we are doing exposure assessment at the ecological level, let's say at the residential locality level, or using satellite data, or monitoring station level using CPCB monitor. So the personalized monitoring of exposure is still a challenge, though we have a few studies available from the team from Dr. Kalpana Balkrishnan in the southern part of the country. But again, it's very exhaustive challenges, and there are issues related to the calibration. But yes, we have to move in that direction to generate a local evidence with respect to various health outcomes. And our team, along with IIT Delhi, is working on various projects in which the individual assessment are done. The relationship I already mentioned, it is not a straightforward relationship. There are a lot of confounders which are available. We really need to collect the information during the research on all the possible confounders so can we address and then attribute the health outcome to the particular environmental exposure, or here in this case air pollution. The sources and characterization particulate matter health risk, again you all are exposure scientists, you know better the characterizations and the in-depth understanding of the the chemistry of the exposure. That again is a challenge, but we are yet to reach at that level. We are still struggling at a more coarse level as far as environmental exposure or air pollution exposure is concerned. Then assessing suitability, vulnerability. So everyone is not vulnerable. Even if you can see the impact is very differential. We really need to document this impact at the differential level, be it a difference at the physical level, the community level, the economical strata level, or biological level. So all these differential vulnerabilities needs to be documented. Now, coming to the take-home message, what we are the young scientists needs to do is to do the knowledge and skill enhancement on of the self for ourselves. And we really need to do the knowledge and skill enhancement for epidemiology, exposure, and the outcome assessment of our interest. With this, and this is a continuous process. We really need to work, and because the science is advancing very rapidly in in this context. So we really need to get updated with the science part of it. So science should be strong, should be robust if you really not to contribute in the research agenda. Take up with the research idea as a thesis and dissertation. We all have the students or the PhD students in the from the health side. We have MD students, DM student. So the air pollution and health effect research has to be taken up as an idea for a thesis and a dissertation, so that whatever scale, whatever miniature scale it contributes, you do the study, you do the research. So that has to be taken up, small steps that contribute to the larger ocean. We have, as I said, the field practice area. So in the country, we have more than 700 medical colleges, and each medical college has a community medicine department. I think most of you here who have joined and may not be aware that each community medicine department has a urban field practice area where they go to the urban community with some captive area and a rural field practice area in the rural areas. For example, in our department, we have a rural captive area, what we call as in the Ballabgarh, where we are doing most of our research, which is more than 100,000 population. And an urban area is in the Trilokpuri near near Dakshinpuri extension. So similarly, all the 700 colleges has this department and they have the respective field practice area. So this is a vast sort of platform available for engagement with the medical college. So wherever you are working currently, try to engage with the medical colleges, try to engage with the community medicine department and the various associations of the community medicine, be it IAPSM, IPHA, so that you can leverage this platform for cohort analysis, for cohort studies and longitudinal follow-up related studies. We have SDSS sites, three SDSS sites. The Ballabgarh, here where we are currently working, is one of the biggest SDSS site in the country. There are other SDSS site in Raebareli, Birbhum, and in Pune, KEM, which has data available for prospective long-term cohort studies, and this has to be leveraged. Then understanding the and priorities for local environmental risk and community needs. Though it is very important, what are the needs and priorities of the local communities? For example, if you are working in northern part here, the local needs are more related to the agriculture burning related issues. If you are working in urban part, it is more related to traffic related issues. So it is important to understand their local priorities and then align your research priorities with their need. Then the chances of uptake of your research finding is key. Because as I said at the beginning, the ultimate goal of any researchers, be it a health side, from the health side or from the exposure side, is to make some tangible impact in the livelihood of the people. So if you really need to make, you really want to make that, then your research should be taken up by the policymakers and the local communities. So for that, you need to understand the priorities of the government, priorities of the communities, the local stakeholders. It is very important. And do not hesitate to take help. As I said, we all are experts in our field and we all are deficient in others' field. So it is important to take help from the others. It is important to take collaborate. It is important to partnership if you really want to contribute substantially in the research agenda. And last but not the least, identify the mentor and promote mentees. It is important to have a guide, sort of guide in your research profession, so that they can guide you properly, and also to generate mentees so that they can take this agenda forward. So that's it. I will end with this CAPHER India network details. We have a CAPHER India email ID, CAPHERindia of gmail.com. And we also have the CAPHER India website where you can visit. And we have Twitter handle for CAPHER India. The website name is capherindia.org. So I invite all young scientists here who really want to work on air pollution and health effect research to join this network. This is free. You will get hold of the various information the work CAPHER India is doing, the capacity building exercises, the consultations, and the advocacy related work. And also we are developing a lot of proposals, research proposal for funding, collaborative proposals where the health scientist as well as the exposure scientist contributes. The five working areas we are working is air pollution and maternal health, air pollution and child health, air pollution, chronic diseases, air pollution, and some intervention related studies, and some accountability related studies, and communicable diseases too. So this is my appeal, and we all know that the team approach, everyone gains more, and we move towards our target faster. Thank you.
Thank you, Dr. Harshal, for sharing your experience, research experience, and thoughts on health impacts due to air pollution. So, now moving to our question answer session. So, there are a couple of questions in the chat box. So, the first question is do you think that there is enough awareness in India on health impacts of air pollution?
This is a very important question. I will not say much about India, but in one of our parliamentarian also said that there is no evidence available recently in the parliament that air pollution causes a health impact. So this is a job of a scientist to generate a evidence, not only to generate evidence, but to disseminate our findings through the appropriate channel. That's what I said. It is important to use media and the community mechanisms for disseminating our finding, because most of the time what happens, we do lot of research, spend lot of money, but that findings, that research findings remains in our lab, in our institute, right? It is important to communicate these findings through various communication mechanisms we have, and that's what the platform, the conferences we have for sharing this platform. And yes, this is taken up recently with respect to as far as air pollution is concerned in our country. Uh, and awareness is increasing. So I request everyone to participate in various activities to increase the awareness from local to global level.
Okay. So next question is, could you please elaborate on air pollution and mental health? Is there some data available in the public domain on the same?
We have, as I said, as I showed in my presentation, there is a systematic review which is, and there are many. This was, I think, we did it 4 years back, and there are a lot of evidence which are available linking air pollution and mental health related outcomes. Be it, and most commonly studied is a depression, because data available. Currently, there is a work going on with respect to National Mental Health Survey and linking it with the air pollution. We are also conducting a national mental health survey part 2 in the mega cities. One of site is Delhi, where we are engaged with the NIMHANS. So evidence is available, and also we need to take up in our various local research where we are doing with respect to air pollution and health.
So next question is what would be some of the domain areas for collaboration with state pollution control boards with the network?
Absolutely, it's a very good question. So, as I said, the State Pollution Control Board really need to engage with the medical institutes, and CAPHER provides this opportunity where the researchers are available from across India from the medical institutes. First area of engagement, area of, as I said, the working groups with the maternal and the child health. We have information available from NFHS related to various health outcomes. We have information available with the MCH, maternal child health outcome, from the SDSS and from the uh, sites of the medical institutes. And the second is the non-communicable diseases related information. Currently in the country, we have a population-based screening program under National Health Mission by the Ministry of Health, where every person above 30 years been screened for hypertension, diabetes, and three common cancers. So this provides a good opportunity with respect to the health data. So if the CPCB and the State Pollution Control Board want to engage, so this the outcome which is available, and some kind of linkages can be done. And also with respect to advocacy, the medical institutes provide a good opportunity for engagement with the community for the CPCB and the State Pollution Control Board. They should use the medical institutes, community medicine department for doing advocacy activity at the community level.
Okay. So next question is, have there been any behavioral studies related to community awareness in air pollution health impacts? Would be nice if you could give few examples and research findings, if any.
Yeah, it's again an important question. As I said, one of my student, MD student, has just finished his work, thesis work on use of this CAPHER application in the locality, urban localities of the Delhi, where he found that very minuscule sort of proportion they are using this suffer application, and whosoever is using it, they hardly have any information or sort of understanding. And again, very less people make some tangible change in their behavior by looking at the AQI levels by or listening to the advisories of this application. So similar studies needs to be scaled up because these are the interventions available from the government side, be it AQI, SAFAR, Samir application. These are the communication tools. So we need to take up these studies. You can see that one of our student did study on the uptake of the Ujjwala schemes. What are the barriers and the facilitator of this Ujjwala scheme in the rural areas. So again, when where we have found that the refilling of the second cylinder is very poor, you know, and there are various reasons. There are very customary reasons are there. There are some financial reasons are there, but that needs to be taken up as a research study and has to be communicated to the appropriate policy makers so that the interventions can be modified accordingly.
Okay, so next question is from a public health student. She asked, how can we come on board to work in field of climate change?
Uh, mm, Again, as I said, there are some institutional mechanisms available for collaboration. There are, I think, 7, 8 centers, center of excellence they have made. Ours is a center of excellence for cardiopulmonary diseases. If somebody really want to work or contribute something, they can contact us. There is a national program for climate change and human health where the capacity building activities has been conducted by the NCDC. So if somebody wants to work, they can join NCDC under this program, or at the state level, if somebody is working at the district level, state level, obviously they can take up this area as far as the administration and the program management is concerned.
Okay, so our last question is from Manish. He wants to know the effects of level of pollution levels versus exposure time. Additionally, is there any exposure study and see the effect of PM 2.5 versus PM 10 versus ozone or carbon monoxide, etc.
So again, I may not be the right person to sort of comment much about the exposure side related studies, but yes, there are a lot of sort of literature available with respect to the PM 2.5 and the PM 10. Again, there is a limitation because in the most of the studies, the data availability is the limitation. You can, and this is being well appreciated by all the researchers. The data availability is the key. So whatever the data available, you use that data. So currently the data of PM 2.5 is widely available. So you will see the mostly studies from PM 2.5. Few like Dr. Sagnik has also developed a model for ozone also. So that can be used for exposure assessment again. So it depends on the data available with respect to exposure. We are still not able to convince our people policy makers with respect to PM 2.5, and there are a lot of the journey is long with respect to the various pollutants which are available. You know.
There is one more question. The question is from Dr. Dipankar. As told that there are 700 medical institutions in the country, then what may be the reason not having adequate data on health impacts?
Again, a collaboration, lack of collaboration. We all work in our silos. You know, we don't collaborate with each other. The exposure scientists don't collaborate with the medical scientists. The medical scientists don't collaborate with them. They don't provide the data. This side doesn't provide the data. So all this, so each one don't know what they are doing. And the ultimate thing happen is no scientific evidence available. So that's what I stress during my talk. It is important to reach out to the people for collaboration. From the health side, they should reach out to the exposure scientists, and the scientists should reach out to the health scientists. This will help us to develop a good, meaningful research and again help in shaping our response to this problem at a country level.
Thank you, Dr. Harshal. So I request all the participants, if you want to ask any question, please mail us. We will post directly to the Dr. Harshal for the answers. So in the interest of time, now to close this session, a formal vote of thanks for him. On behalf of CERCA, I want to extend my sincere thanks to him for accepting our invitation to deliver this talk. And it was real pleasure and honor to host you, our expert speaker this month. And finally, I also want to thank all the participants representing from different sectors and took time out for attending this talk and making this session interactive through Q&A. And thank you once again. And we will announce our next scheduled talk through email and social media handle soon. Thank you so much.
Thank you, Dr. Harshal, and thank you,
Thank
everyone.
you. Thank you. Namaskar.